Hello all. Welcome to Practolytics, your healthcare partner. Thank you so much for joining in the part 4 and the final video from the Transitional Care Management series that we are doing. From the last 3 videos, you have learned about the basics, coding guidelines, documentation requirements associated with it. And with this video, you will be also learning the limitations and the billing guidelines. So with this video, you will be understanding what's a TCM service in and out. So with no further delay, let's start the video. The agenda of this video is to help you understanding the limitations associated and the billing guidelines for a transitional care management service. Now, the first thing that comes into picture when we talk about TCM is the date of service. The 30-day period for a TCM service begins on the day of the discharge and continues for the next 29 days. The date of service you report should be the date of required face-to-face visit, and you may submit a claim once the face-to-face visit is furnished and need not hold a claim until the end of the service period. Moving to the frequency of the billing. If during the month the patient is seen more than once for a follow-up visit, any other visit made during the 30 days can be billed separately using a E&M code. The TCM codes are used when the provider wants to assume responsibility for the patient's post-discharge services to try to prevent the patient from getting readmitted to the hospital. That should be the ultimate goal of this service. Chronic care management. This could be billed to the MPFS during the same calendar month as TCM only if the TCM service periods ends before the end of the given calendar month. At least 20 minutes of the qualifying TCM services are subsequently provided during that month, and all other CCM billing requirements should be met. However, in majority of the cases, CCM and TCM will not be billed during the same calendar month. So please keep a note of this point. And what happens if the patient gets readmitted into the hospital? Let's see how to deal with this scenario. TCM services can still be reported as long as the services described by the codes are furnished by the practitioner during the 30-day period, including the time following the second discharge. Alternatively, a practitioner can bill for TCM services following the second discharge for a full 30-day period as long as no other provider bills the service for the first discharge. However, CPT guidance for this services states that only one individual may report a TCM service in that 30 days period. Another TCM services may not be reported by the same individuals or also the group of any subsequent discharges within that 30 days span. Now, keeping a track of the global services that are rendered to this patient is extremely important. Let's see why. Only one provider may report a TCM service within the stipulated time, and another TCM service may not be reported, as we discussed. Lastly, if a provider performs a procedure within a global period, then the same provider may not bill the TCM services during that global period for that patient. And let's also see the utilization indicators that are associated with this service. Place of service. The discharge must be to the patient's home. It could be a domiciliary center, a rest home, or a nursing home, or an assisted living facility. Please do remember, skilled nursing facilities do not apply or does not fall into this category. Codes must be billed using the 7th or 14th day as the date of service, and only one professional should be reporting this. If more than one physician assumes care and a claim is denied when you report it, then the ideal way of getting paid is you can bill that particular visit using the evaluation management code. This would help you in actually getting reimbursement for the services if you're billing within the same period. And I hope this series helped you in understanding the entire TCM concept in and out. If you still have any questions or if you still have any queries, please do contact us and speak to our professionals to get more information on this. And thank you so much for your valuable time and interest on our series. We will be back soon with another amazing content. Please stay tuned.